supposed to be there for a specific patient, those are overloaded and overcrowded by those who are not who are not supposed to be there in the first place. So it's not the people's fault. It's the missing link which government should have provided earlier, but government, should be doing it today. And this is what we're doing it exactly today. Without thinking of anything cosmetic, we are working on a concrete solution. And this is the missing link. We are focusing more and more. And inshallah ta'ala, time will come when there will be a referral system to the tertiary care hospitals. The people who have been referred to go to there, those are the ones who will be traveling and will be going to those tertiary care. Otherwise, 90% patient will be taken care within the range of a kilometer or half a kilometer from their house to those BHUs, those primary healthcare system in Pakistan. We are working aggressively on it, and in that today, when we plan to bridge those gaps, that means again, if we go on a traditional way, that means you have to build more small BHUs, more hospitals, bring more doctors physically there, and then the equipments and hardware, so on and so forth. But in today's world, and that's gonna, again, it's a bricks and mortar kind of solution again. Government will indulge into giving contract, giving out the contracts, then it's a normal procedure of these things, takes long. So it's going to take ages to fulfill these gaps. But in today's world, what we are witnessing at this moment, the developments of technology, digitization, in terms of healthcare system in the world, we have come to know more during the COVID time, the thing called telemedicine. Through this telemedicine, in our primary healthcare system, we don't have to bring the doctor physically there. We don't have to bring the appoint. Don't have to bring, spend more and more on civil works there. Today, whatever we have available, if we have a little bit, we provide a little bit training to the local staff there. Those staff could connect through the technology, through the telemedicine, to a doctor who is very qualified, who is very knowledgeable, but not physically present there in that premises, sitting somewhere outside or sitting even offshore somewhere, and will be looking after those doctors, those patients, as good as somebody, while sitting physically there could have looked at it. So this is not the dream. This is what the federal government right now, we are doing it. We have launched a pilot project of 10 BHUs in Pakistan, 6 in Islamabad, 4 in Karachi. We have got 4 premises there in Karachi, federal government premises, and 6 in Islamabad. And I have personally, so far, we have inaugurated 6 so far, 2 in Karachi, 4 in Islamabad. And I personally go to all those inauguration. It's a very small thing to me, but it's a very big step to fulfill these gaps between of our healthcare system here in Pakistan. So that's working tremendously. Just to share with you that people, the doctors, especially the female doctors, who have not been in this in the system, in the healthcare system, they are qualified, but due to their own personal reason, they did not practice. They're the normal housewives, sitting in their own houses. Those doctors are being brought in the system. While sitting in their home, they are fulfilling this job, to see the patient sitting somewhere, very far away. I was visiting that day to one of the BHU, and a doctor was online and patient was in one of the very remote area of Islamabad, outskirts of Islamabad. And when I asked that where is this doctor Saiba is sitting, so I came to know that she's sitting in Qatar. She was sitting in Qatar, Doha, and seeing the patient here in outskirts of Islamabad, how tremendous, how revolutionary it is all about. And so we have provided the specialists 2 days in a week. There will be specialists sitting online. There will be child specialists, then five kind of categories are there where specialists will be provided. What I'm trying to bring in front of you this August gathering is that government is very cognizant about this whole thing. We do understand the gap, and our directions are very clear. And not only the talks, we are working our talks actually. What we say, we are doing it. We are practically doing it. Yes, it's not being very visible because it's just a beginning. But to me, when I inherited this whole thing and this whole entire system, I felt that our directions wasn't very clear. We were not talking about this BHUs and primary health care. Everybody in amongst the ranks and file of these politics, we used to talk about the big hospitals and tertiary care and so on and so forth. Then comes the prevention steps. And in that prevention, indeed, the population, the rate of population is, in this country, how many people the system is capable of treating it. That should be the question. How many sick people we should have? How many hospitals and what big the infrastructure of this healthcare should be. So we must take a breath and think wisely and carefully. We have got the population of 240 million people in Pakistan. 6.19 million babies are coming every year, more than a population of New Zealand. Every year we are including a country's population in our system. And then we have got 13, when these babies are born, then 13 different vaccines being provided by the government. And that's where the reluctance is. More than 400,000 babies are zero dose children here in Pakistan. Just imagine. So we have got bigger population. We are, and I would say, it's harsh to say, but we are killing 11,000 mothers every year in Pakistan during pregnancy. 11,000. Out of 10,000 pregnancy cases, we are killing 400 women, mothers. 400. This ratio is not even 0.1% anywhere in the world. And we are killing 11,000 mothers every year. A small incident takes place in Pakistan, God forbid, Khuda na khasta, unfortunate incidents takes place where 30, 35, 40, 50 lives, precious lives, they die, they are martyred. Any incident in Pakistan, the entire country mourns. Entire country becomes, gloomy, sad, things, 2-3 days, you don't feel like doing anything. But is anybody noticing that 11,000, just keep all those 11,000 bodies at one place, and do the namaz-e-janaza. Which ground we will choose? Which ground we will choose? 11,000? Just because those mothers are dying quietly one by one? That's why we give no hoots about this whole thing. So it's a mockery, it's like hypocrisy in this country. That only we will mourn on those who will be killed by the bullets and by the bombs and with any accident. We will not be feeling sorry for those who die in delivering a child. And that pregnancy is not a disease in the world, without any disease. So yes, Allah has a promise in His Quran that He will take care. The food security has been given to every soul, every human, every creature. That's one part. We are not. It's a said and done thing. But Allah has also asked us to take care about a human life. Be very cognizant about the human life. Even saving a life, one life is saving the entire humanity. This is also what He has said. So these women are being killed, 11,000, by delivering more child. They don't have their body doesn't allow them to do that. Yet they're doing it. We must stop it. Just imagine a mother of a family dies. What will happen to that child? What will happen to the other kids? The entire family's ecosystem is gone. So before this primary health care, we must set our house in order, please, for this healthcare system, because this is the national security issue of Pakistan. Yes, let's make no mistake. This is the national security issue of Pakistan. This is the economics issue of Pakistan. Haven't we seen the COVID just a couple of years back? Still countries could not come out of those quagmire, of those created by that event, by that COVID which took place there in entire world, shook the entire world. Why? Because what happened in COVID, leave the pandemic aside, it happened just at one point of time, many people started falling sick. This is what happened, right? And then we saw that if people will fall sick at one specific point of time, then the superpowers healthcare system, even they also collapsed. America collapsed, UK collapsed, Europe collapsed, China collapsed. Why? Because at one point of time, many people fell sick. So, and then economy is gone. System gone. That's what happened in COVID. We all have seen from our own eyes, experienced it. Come now, keep that in mind and come back to in our system. There's no pandemic right now, but yet many people at one time are falling sick in different diseases. So the same scenario is taking place here in Pakistan as well. The system is about to collapse. And with this growth, 3.6 fertility rate, if we have the GDP of 10 even of the country, even then we will not be able to cope with this. We have got the 3.5 GDP or 3 point something. Even 10 GDP gross domestic product will not be able to cope with this fertility rate in Pakistan. So for God's sake.
वफाकी वज़ीर सेहत सैयद मुस्तफ़ा कमाल प्राइमरी हेल्थ केयर तकरीब से खिताब कर रहे थे। उन्होंने कहा कि पाकिस्तान में प्राइमरी हेल्थ केयर के शोबे में कम काम हुआ है, इसे मजीद बेहतर करने के लिए इकदाम किए जा रहे हैं। ये थी PTV ताज़ा तरीन।
दुरुस्त हर वक्त बार वक्त। दुरुस्त हर वक्त बार वक्त।
बांग्लादेश में तारीखी आम इंतखाबात के लिए पोलिंग का अमल शुरू। बांग्लादेश नेशनलिस्ट पार्टी और जमात इस्लामी के दरमियान कांटे का मुकाबला मुतवक्के। इंतखाबात के पुरअमन इनेकाद के लिए मुल्क भर में सिक्योरिटी के सख्त इंतजाम। इंतखाबात के साथ आईनी और कानूनी इस्लाहात के रेफरेंडम का भी इनेकाद। 12 करोड़ 70 लाख से ज़्यादा वोटर्स किराए रही इस्तेमाल कर रहे हैं। पोलिंग बांग्लादेशी वक्त के मुताबिक शाम 4:30 बजे तक जारी रहेगी। 1981 उम्मीदवार मैदान में। हुकूमत साजी के लिए 300 में से 151 नशिस्तें हासिल करना लाज़िम। सदर आसिफ अली जरदारी का बांग्लादेश में कौमी इंतखाबात के इनेकाद के मौके पर नेक तमन्नाओं का इजहार। बांग्लादेश के अवाम के लिए पाकिस्तान की जानिब से नेक ख्वाहिशात और मुकम्मल हिमायत का अयादा। बांग्लादेश में 12 करोड़ 70 लाख से ज़्यादा वोटर्स आज अपने नुमाइंदों का इंतखाब कर रहे हैं, जो जमहूरी अमल की मजबूती का मजहर है। इंतखाबी अमल बांग्लादेश